right, you're welcome back. And we're taking a look at the Lagos University Teaching Hospital's resident doctors and health workers strike, and what some people have obviously been describing as state of disrepair in the hospital. But we'll bring you that report in just a moment. But let me welcome into the studio those who are with us at the moment. Dr. Olubunmi Omojowola, who's the President Association of Resident Doctors in LUTH. Good morning and welcome, Doctor.
Thank you, sir.
And then on the other side is Mr. Kende Adegoke, who's the Chairman, Joint House Unions and Association at LUTH. Good morning and welcome.
Thank you, sir. Good morning.
We were expecting the Chief Medical Director of LUTH, but unfortunately, Professor Shibogun could not join us this morning. He expresses apology. He did say he's sorry he's not able to, but that he has committed to come in and be a part of this program at some point in the very near future. But we'll still carry on. We had a conversation very late last night, but he couldn't make it. Well, let's take a look at the report that that's been creating some stir in the industry and around the country that shows what has been happening at LUTH before we get into the conversation.
I'm here in one of the sanitary facilities at the Lagos University Teaching Hospital. This is a toilet, and here is a bathroom in one of the surgical wards. These pictures speak for themselves. The situation formed part of the reasons behind the over 1 week indefinite strike by resident doctors and other health workers at LUTH.
Somebody that is sick, no nurse, no doctor.
The patients are groaning. Most have discharged themselves. 52-year-old Mrs. Eunice Akwetie summoned energy to tell us about her plight and that of other patients at the hospital ward.
As I'm here, no water. There's no water, no lights. Even patient, there was one patient who was pregnant yesterday. She fell down from the bed by herself. She wanted to carry a bedpan. Facilities is old. Even most of the bed we are lying down, the mattress is torn, the bed cannot roll, and most of the things that they don't want to use to walk, they cannot see. And these are making work difficult for them.
This difficulty is what the striking resident doctors and other health workers at LUTH want corrected. The cost of medical treatment is also a worry.
The issue of pricing of services in the hospital. As doctor, we feel the plight of our patients as they are complaining bitterly under the heavy burden of this astronomical increase in prices. And, we are talking of a situation where ordinary court, you want to secure it, you will have to pay over 50,000 naira.
But the medical director of the hospital, Professor Akin Oshibogun, says the situation could be seen as a half-empty or half-full cup.
What we need to be looking at is to be comparing availability with the service that is not available. If you are going to provide those needed services that are specialized and that are complex, they have costs. Those areas of excellence, you cannot achieve them without water, without electricity. There's no how you can use your laparoscopic equipment without electricity. You know that we have electricity as a challenge nationally, but then the government has supported us by providing us with generators in all our critical service areas.
Challenges in the country may permeate every sector, but dirty environment, especially in a hospital of LUTH status, can only breed further health challenges, which the current manpower may not be able to contain. Yomi Otaibu reporting for Channels Television News.
Okay, so that's the report that has generated a lot of stir and made people to wonder, how did we get to this point? And I guess part of the issue has been the fact that resident doctors and other health workers within the Lagos University Teaching Hospital, they've gone on strike. I can't remember for how many days now. So let me ask Dr. Omojowola, who's the President, Association of Resident Doctors, how long have you been on strike now?
Yeah, thank you very much. Our Indefinite strike started on the 2nd of June. That's
2nd of
about
June.
2 weeks ago.
Okay. Now, what are the issues for you? Why are you on strike?
Okay, thank you. The issues are very clear. Number one issue, as had been said in the report, is that we are very worried as doctors working in LUTH about certain policies which directly impact the life of Nigerians. We are talking about pricing of services in the hospital. Certain services prices have been increased to a level that is not within the reach of average Nigerians. And this particular problem is not just a problem.
Can you be a bit more specific? What are
Yes.
these things, if you want to look at it in clear terms, what are the things that you will point to? This is costing too much, that's costing. What exactly are these
Okay,
things?
thank you very much. Let me give examples so that we can understand what I'm saying. Just about over a year ago, suturing of cut, wound, laceration was about 8,000. It went up to 50,000. If you want to insert a chest tube to drain fluid or water inside the chest, the minimum you can pay is 50,000. Sometimes you may have to pay up to 100,000 when you add all the other costs. And sometimes also, when you are talking of cesarean section, from 35,000, it has gone up to about 130,000.
So when you say that, are you saying that patients are expected to make this payment before they're being treated?
Yes, thank you very much. Sometimes there was a policy before we went on a warning strike that patients must pay before they are attended to in the emergency. However, that particular policy has been reversed. Now, these payments, most of the time, patient has to pay before they get those services. Because if you book a patient for surgery or for CS, if it's an elective case, the patient has to pay. But we have discussed with the management concerning emergencies. So that policy of non-payment before you are being attended to has been reversed.
Now,
so based
Doctor,
on our agitations.
Doctor, let me just take you way, way back. When I was growing up, you didn't really pay as such, especially in LUTH. So people wanted to be referred to LUTH.
Yeah.
When did LUTH become so commercialized?
Okay, thank you very much. You see, the act that established the hospital is very clear. It is for purpose of training, research, and care. Training at both undergraduate and postgraduate levels. So that is the core objective of establishing a teaching hospital of LUTH standard.
Yes.
It is never for profit making. And you see, when patients come to the hospital, they are playing dual role. They are coming for treatment. They are also being used to teach. So when you are using somebody to teach doctors, then you should subsidize the treatment for that person, because the person is indirectly also rendering service to the nation.
Of course.
You need to have well-trained doctors, because when the patients cannot afford the services, then they go to quacks, and then we don't have enough patients to train doctors, which also now start turning out dangerous people into the society. So we don't want that, and that's why we say the management of LUTH. Now, the problem is not just LUTH. You see, the state of the health sector in Nigeria is abysmal, and the funding is abysmal. You see, just about few days ago, the Nigerian Medical Association brought out a communique where it is stated there should be a trust fund to actually revitalize most of all these centers, and patient treatment should be subsidized in a teaching hospital setting. Okay. Most Nigerians are very poor. Minimum wage is less than 18,000. How do you expect somebody to now afford over 50,000? Even if something happened to me now, God forbid, as a doctor, even as a doctor, how much of this thing can I afford? Talk less of people who are selling things on the street. And our hospital is located in Mushi, Idiaraba. The people surrounding us are very poor people.
All right. Let me jump over to the other side. Mr. Kende Adegoke, you're the chairman of Joint House Unions and Association within LUTH. What is your own gripe? What's your concern? Why is your association and joint union, why are you on strike?
Well, coincidentally, we are on strike for the same reason.
And when did you start yours?
We both started coincidentally the same 2nd of June.
Loads of coincidence then.
And we independently we wrote to the management over all these issues that we have seen. They are obvious. And we wrote, we had to talk, and we are not seeing that enough willingness to actually address this thing. And a number of our members are falling sick because there is so much shortage of hands to work. A number of them have retired, a number of them have traveled abroad, and they are not replaced. And we have so much shortages of hands and in various departments. And then issue of consumables, issue of equipment, all these things are serious challenges for us to deliver. And then you talk of profit, PPP, the kind of model we see, like where you have a private laboratory, completely private, part care laboratory inside government system, and you call that PPP. It's complete. I mean, we know a number of organizations that are ready to assist us with equipment that all they need from us is to buy their consumables, and we'll move on. But we've talked a number of times over this issue, and we are not getting positive response. And we put a position paper sometime in February. Even that February, we had an industrial action late December, precisely 31st December, and we rounded up February 5th. And some of these issues were raised. We suspended the action with the hope that negotiation will continue. And we were promised a number of things, but up to when we started this current action.
What were you promised?
A number of things, like they will address things, that they will employ new hands before the end of first quarter. The hospital will look into issue of consumables, issue of equipment.
Mr. Duke, I'm sorry to butt in. You're talking about they. Who is they?
I mean the hospital.
The hospital management or the federal government?
The hospital management.
Okay.
Were you at any point under the illusion that the management would have the capacity to buy all of those things that they were promising?
Where? We had high hope because they didn't tell us they would not be able to get us. We are not asking for what they use in America or any of those big society, developed society. We are asking
not
for
that there's anything wrong with asking for that.
Of course, nothing is wrong with that, but we are just asking for minimal equipment, minimal materials that will make us survive accreditation.